we wanted to implement some supplements to shift his body into utilizing glucose over fatty acid oxidation because that improves the amount of ATP that can be produced by mitochondria with the same amount of oxygen levels. Glucose is just much more efficient. And so there's a great supplement which can actually achieve this called mildronate or meldonium, which works by inhibiting L-carnitine levels, thus prioritizing glucose for fuel rather than fatty acids. Although there is a better medication which is often prescribed for angina in other countries outside of the United States, which utilizes glucose much more effectively than things such as mildronate does. It's a very good medication, but hard to find in the United States, and we're actually able to get that for him. You see, when you take metformin for a prolonged period of time or in high doses, it can paradoxically cause a problem in which it worsens diabetic progression because it inhibits a certain micronutrient which is needed for insulin sensitivity, which not many people know about, but very important. And we wanted to do a complete overhaul to his blood pressure meds because he's actually on an ACE inhibitor, which is not the best medication in his case because it leads to less breakdown of bradykinin. And when this accumulates, especially in the lungs, it can stimulate coughing. And somebody with COPD does not want to be coughing more. But he was also on a beta blocker and also on too high of a dose of both of these medications because he was actually dipping into hypotension periodically. And I actually had to recommend that he drinks coffee in some cases just to get himself out of that. So it required a complete overhaul to his blood pressure meds to take care of. The brand name would be Lasix there, and he needed this medication to reduce the edema in his lower legs. However, we didn't get him off it immediately. He needed it, but by the end of the program, he was indeed off of it, and that just goes to show the effectiveness of this program.